Pressure by anti-vaping public health groups on Health Canada to take drastic and immediate action in order to stem the so-called epidemic of youth vaping reached new levels in the past weeks following the long overdue publication in the British Medical Journal of a study led by Professor David Hammond of the University of Waterloo into the prevalence of vaping and smoking among adolescents in Canada, England, and the United States. Results from the University of Waterloo study do appear alarming, as it found among those 16 to 19 years old surveyed, vaping increased by a stunning 74% from 2017 to 2018. And even more concerning, the study found within that same age group, smoking rates increased by a shocking 45% over the same time period. Joining us today to discuss the findings of the study and to pick through the impact is Dr. Chris Lalande, Professor of Psychology at the University of Victoria. Dr. Lalande is a developmental psychologist, and his research focuses on how culture influences identity formation and how the pursuit of self-determination fosters youth health and well-being. Dr. Lalande, thanks for coming on RegWatch.
Thanks for having me.
Well, I know that you have a keen interest in the relationship between policy, youth, and well-being, and you're also working closely with First Nations in BC and Manitoba. Please share a little bit of that detail for our viewers.
Sure. Well, I'm a developmental psychologist with a particular interest in adolescence and young adulthood. And one of the things that fascinates me is that the ways in which we as a society think about young people and about development and the kinds of policies that we put in place form the environment in which youth develop. So they have a real and direct impact on the lives and the development of young people, adolescents, and young adults. And so I've been interested in how those big policies, those big societal changes actually impact youth health and well-being. And one of the areas that I've been looking at is how the pursuit of self-determination and the maintenance of First Nations culture actually works to create a healthy environment in which youth can develop and enjoy good health and well-being and thrive. So that's been the nature of my work with First Nations.
So essentially, public policy matters even with child development.
Absolutely matters. It's a crucial element of the developmental landscape in which children grow.
So let's jump in now to the University of Waterloo study. What were your overall thoughts about the research? What was your reaction when you first read it?
Well, my reaction when I first read it is I don't doubt the findings of the study. I don't doubt the data sources that they used. What was particularly concerning to me was the media reaction. And some of that was in your intro. You used the word stunning and shocking. And if you look at the numbers that are actually contained in the study, you have to ask yourself, as a parent, as a member of society, what in here should have me worried? And frankly, the vaping increase of 74%, I don't think as a parent would worry me. I'd be much more worried in particular about 60% of youth using alcohol in the last 12 months, or something like 30% using marijuana in the past 12 months. But more concerning than any of that actually is the reported 45% increase in tobacco cigarette smoking. So smoking rates among youth have been dropping for decades. And this is the first report I've seen. It's a 1 year to the next, but it's a huge increase, 45%. That should be the shocking and alarming thing about this study. But the media coverage has been essentially silent on those numbers, and they're focusing on this 74%. Now, the 74% is also a bit concerning because it's based on any past 30-day use. So the trouble with that is, if you're interested in a health risk, right, you're worried that youth are being exposed to something risky or dangerous, the most important question you ask is, what is the level of risk? How much exposure do youth have to the thing that is risky? Now, if you're measuring one puff on a cigarette or one puff on a vaping device as any 30-day use and a measure of risk, it's not a very good measure of risk. It's not a very good measure of exposure, either for vaping or for smoking. And if the sort of moral panic that's happened about the epidemic of vaping is this sort of gateway notion, the idea that what we're really concerned about is those youth that have never been smokers.
Right.
And they're going to become vapors and then somehow magically become cigarette smokers. But here I think we can take some comfort because among never smokers in 2017, the study found just 5 young people out of 2,700 who were using e-cigarettes that frequently. In 2018, the year the epidemic allegedly took off, they found 14. So it went from 0.2% to 0.6%. And so at the highest exposure level, I'm not sure we should be shocked about a whopping increase that goes from 5 young people out of 2,700 to 14 out of 2,700.
Let me ask you this, Dr. Lalande. The Canadian Cancer Society had put a lot of their weight behind the publication of, or pushing the story and the narrative behind this study. And, you know, one of the things that they said in their press release that went out, and a lot of the media used a lot of the Canadian Cancer Society's release verbatim. And one of the things that the Canadian Cancer Society said is that the past 30-day use, which is a common measure for smoking prevalence, they made sure they were calling that out, that this particular measure is the common, it's the one that we use. Yet you're saying here that it's not a very good measure. We've had Linda Bald on our show from the UK. She's a researcher there, and she's outright, excoriated the 30-day use. Can't find anybody in tobacco harm reduction that thinks a 30-day use measurement is at all reliable. So it seems to me that it's just this one side that uses that measure, and that's the side that gets all of the headlines on CBC, on Global, throughout all of the media.
Well, just because it's a commonly used measure doesn't mean it's a good measure. And I think I'd agree with Linda Bald that it distorts things by inflating the numbers of exposed people without really telling you much about the level of exposure. So it doesn't differentiate between one puff on a tobacco cigarette and smoking 2 packs a day. And that distinction is critical if you're really interested in public health.
Coming from the research community yourself, explain to us that process in which lead author, Professor Hammond, and also some obviously great researchers that are on that paper too as well. And there's a peer review process too that's involved. Once all that it gets done, who decides then what it is to focus on to then drive it through the media? Because it seems that somebody had to make the decision to focus on 74% in the past 30 days as opposed to the 15 days and the other kind of categories that would show maybe a more balanced perspective.
There's 2 sort of parallel processes that are oftentimes working against one another. So the standard scientific model is somebody submits a paper to a journal, the journal editor gathers up a group of people that he or she thinks are best placed to be peer reviewers of this work, sends the manuscript out to them, they review it, make suggestions for changes. Typically the authors will revise the paper, and then maybe it gets accepted by the journal. Then the journal publishes it. Then other scientists read it, and science marches on. The parallel process, and sometimes contradictory process, is that we appear to be living in an age of science by press release. So somebody gets a paper published in a journal, and someone at typically their university will write up a press release and send it out to the media. Now, in a world where press releases are like a blizzard every day, you have to ask which ones are going to get the attention. Well, they're going to get the ones that lend themselves most likely to the most searing kinds of headlines. So if you use words like shocking, stunning, alarming, or innovative, groundbreaking, and those things are typically peppered through press releases. And then part of the problem, present company accepted, is that journalists don't often actually read the paper. They read the press release and go from there. And so things can appear in the press release that you'd be hard-pressed to find in the actual study. Or they'll pick one thing that they think will get the biggest reaction and focus only on that and not on the other good news or more alarming news that might be in the paper. So, for example, in this paper, as I said, I was most concerned about the increase in cigarette smoking. That's the most dangerous thing you can do. And so if it really went up 45%, we have a big problem here, vaping aside, or marijuana aside. So fortunately, the Stats Canada numbers came out a couple of days ago, and they show reassuringly that once again, youth smoking rate just continues to relentlessly fall. So even the most frightening news out of this paper is not really anything that we should be worried about. I think the Stats Canada numbers are more robust.
So Dr. Lalande, I've put this up on the screen here for our viewers, and we're talking about the Stats Canada numbers that came out last week, so just right towards the end of June, just actually not even a whole week after the Waterloo study was published. So, and this is what StatsCan put out. So why don't you walk us through that? If you can see, I think the big area here is the 12 to 17 years old.
Yeah, now that's pretty close to the 16 to 19-year-old age group that was in the British Medical Journal study. And you can see it went down from 3.5 to 3.2. In fact, every one of those numbers went down from 2017 to 2018, except I believe it's the 18 to 34.
That's right, 18 to 34 stayed at 19.2.
So the fact that none of those numbers are going up and all but one of them is going down, I think, is good news. We can continue to be confident in the fact that youth smoking rates, and smoking rates in pretty much every age group, continue to drop.
Also provided by StatsCan was the daily use, because that was the occasional use, and this is now the daily.
Those are the people that are at the highest health risk. They're daily smokers, okay? And you can see that every single one of those numbers went down once again. So 12 to 17 went from 1.1% to 0.9%. That's vanishingly small smoking rates in that age group.
What does the E mean? I've never seen Stats Canada put an E beside a stat, and then down below it says use with caution.
That's because the incident rate is so low that you can't be certain about the statistics that you apply to it. Okay, so that's saying the next level down would be not detectable.
In terms of not detectable level of smoking.
Yeah, because the numbers of 12 to 17-year-olds who smoke daily is so small that you can't have any real confidence in the statistics or the number that you run around it. And that's good news.
Well, not only good news, you're saying that almost in a way we might be seeing the capturing in data of the very last of the teenage smoking.
Well, if this data trend were to persist, it's been going down for years and years, and at some point it looks like it's going to hit zero. It may never hit. Most targets are like 5% of the adult population still using combustible tobacco would be somehow acceptable to people like the World Health Organization. But now the trouble is the 12 to 17-year-olds in 2017 were 13 to 18-year-olds in 2018, right? You keep replacing the groups as you move along. So it's not like you're following people over time. But I still think we should, as a society, take great comfort in the fact that smoking rates continue to go down and they're lowest among the most vulnerable, the youth.
I've got a difficult question to ask because I'm asking you to directly address the incongruent numbers that are so astonishingly different. So we've had, and I mean, I can show you right now CBC pieces, global pieces, all from the last 10 days, talking not just about the vaping, but also the smoking rate, like hair on fire on both vaping and then 45% increase in smoking. So how do we square this? Because Dr. Hammond's research saying 45% just doesn't square with what the government is saying.
Well, it's statistics have a tendency to be noisy. So whenever you run statistics, what you do is you take a population of people, in this case, all the young people in Canada. You say, well, we can't interview or get all of them to fill out a questionnaire, so what we'll do is we'll get a sample of them. So some smaller number of them, get them to fill out the questionnaire, and then we use statistics to estimate how likely is the findings from that smaller group of people to be representative of the entire population. And there are various fancy statistics that can do that. You are much more likely to get an accurate measure of what the real full population is doing when you use a much bigger sample. So the BMJ study is a much smaller sample than Stats Canada. The BMJ sample was also not a representative random sample of Canadian youth, right? They were recruited through a particular purpose. Now, the authors acknowledge the limitations of that approach, and I agree with them. It's a real limitation. Is it necessarily wildly wrong? Well, that's due to the statistics. So they could run the same study next year and find a 10% drop. It's noise in the data. When you're sampling, taking a small sample from a very large population, you're going to get, the lead author referred to this as statistical blips. And I think the Stats Canada data backs that up. It's not going up, it's going down.
Well, I mean, we're talking about 45% increase versus there's almost no smoking at all.
Yeah.
Well, let me ask you, I know it's tough. I understand I'm putting you in a spot here, but I have to press this because our viewers want this pressed for good reason. Isn't there some kind of responsibility from the researchers to take a look at the results from their little machines and numbers and go, wait a minute, this just doesn't square with what we know is reality? And then most importantly, don't they have a duty to know what people are going to do with the results of their study? And if they know that it's a blip, do they not go, yeah, but there's going to be adult vapors that are going to have a hard time sleeping at night, wondering whether or not they're going to be able to keep their vaping? Because the same researchers also selectively shared this data with Health Canada, the regulator, before they shared it, before it got published. I mean, it just got published. So this data has been used to drive regulatory policy in Canada, to potentially damage adults' access to vaping products, and to continue the demonization of tobacco harm reduction through vaping throughout the entire media. And this data continues to do that. So I'm not certain whether or not it's just acceptable for researchers to go, well, we think it's a blip. I really think he needs to be held to account.
Well, there are an awful lot of things that you just mentioned, and I'll try and pick them off one at a time if I can. So I talked a little bit about the difference between the kind of scientific publishing model and science by press release. And those two things often work at loggerheads. So it's incumbent upon the researchers to accurately report their methodology and their findings and their results. And in this case, I think the researchers actually did that. They note the limitations. They note that they would like to see regulation work to promote vaping among adults and discourage it among youth, and everyone seems to agree with that. Should the researchers have paused when they saw that 45% and looked around, I'll leave that to the researchers. That is the number that came out of the data that they found. Now, many of the problems that you also mentioned arise from the science by press release, that people jumped on the 74% because it feeds this common narrative that there's an epidemic of vaping among youth and they're all on the slippery slope to tobacco, cigarettes, and certain death. And so it fits that narrative. So the media really jumped on that. And I think, tobacco harm advocates need to push back on that and say, well, wait a minute, the stats can numbers just came out and they are going down. How can these two things both be true? And the answer to that is it's a simple function of statistical analysis. You are going to find blips. So the question is, what do you make of those blips? Okay. And that's where I think things go wrong. Now, I think to the more maybe pressing issue, particularly for you and your viewers, has to do with sharing the data with Health Canada to influence policy before it was through the peer review process. That worries, it concerns me, because typically what you do when you set up a study or an experiment is you say, here's what we're going to do, and we're going to keep doing it until we've tested 1,000 people or 2,000 people. And so, for example, in random controlled trial experiments that are the sort of gold standard of medical research, where you're comparing one new drug against some old drug or against a placebo, and you say, we're going to randomly assign people to groups, give them the new drug or the placebo, and see how many survive for a year. So if partway through that year you discover that the people taking the new drug are dying at 2 or 3 times the rate as the people taking the placebo, you break the code. You stop the experiment. You say, wait a minute, there's no sense following the scientific method and continuing to expose people to this risk. So I think one argument can be made that these results were alarming. 74% increase in vaping. We need to share this with Health Canada even before the peer review process is out. So you could make an argument for that, and you might convince people of that. But it seems to me, if you're going to use information that only you have and use it to influence public policy, you ought to be obliged to release the full data set. You ought to be obliged to make the public aware of what it is, what data is being used to influence policy in Canada, because the policy is going to affect all Canadians.
Well, then, of course, RegWatch did actually publish the draft version of that study that had been leaked to us by a pretty high-placed member in tobacco control after our interview with the Director General of the Tobacco Control Directorate at Health Canada, who directly referenced this research and referenced the fact that this research was part of providing substantive concern both to the Minister of Health and to Health Canada, which kind of launched the regulatory consultation process. So we felt we had a duty to release it, though I do know there was a bit of controversy amongst the research community about that. And, we're open to hearing what that is. If you want to share what some of the pushback was, we'd be happy to hear that.
Well, I think in the same case, you mounted an argument about why you felt you should have released the data. And I think some people will be convinced by that. Others won't. Others in the scientific community will say you shouldn't be sharing data with anybody until it's through the peer review process. The whole reason for that process is to find and correct errors in data and interpretation. So I'm not sure the authors should have released it to Health Canada. Given that they did, I think that changes the nature of the game. Had RegWatch released the leaked study before it was shared with Health Canada, I would have said shame on you. But given that Health Canada was actually using it in ways that directly affect the health of Canadians, then I think you could argue that your hands were tied. You really were obliged as journalists to release it. And I think many people in the scientific community would find that argument convincing.
Yeah. Well, it's too bad. When research is impacting public policy, that's okay. It's just it needs to be out there for everybody. And we knew that the way the timing works, that all of the regulatory consultations would be closed and done. So none of the people that were, wanting to, impact the consultation process would have had access to the data unless that we released it. So there you go. Let me ask you this, because there's another concerning aspect that comes out as we dig into the research study, which, by the way, on the last bit on that, RegWatch specifically made a point of not going into that draft and doing any reporting on it at all. So we just released it. We got some feedback from Clive Bates and just on kind of the overall aspect of it, but we didn't participate in any of the kind of picking at it at all or picking through it until it was published. Now it's published, and now we're picking through it. There's something very disturbing. We know in the study from the timing that even the hypothesis of the research is very connected to Juul entering into the market. And the question is, and it's a serious one, I think it could undermine the credibility of this research, is the fact that Juul wasn't even in market in Canada until September of 2018. And the panels for the survey for 2018 were August and September. So how is it possible that they've captured any kind of use that could be statistically relevant to have this study say what it does?
Well, the claim would be because the use of Juul went from 0% in 2017 to 10% in 2018. Well, how could that be otherwise if it wasn't on the market in 2017? So the hypothesis was the effect of the change in the regulatory climate in Canada. And so that includes the May sort of legalization of vaping and the entry of Juul in September. It seems to me that if you're collecting data in September, the very month that Juul hit the market in Canada, I'm not sure what conclusions you can draw about the effect of Juul on the Canadian market. So, for example, they did ask young people about the brand of e-cigarettes they use. And in 2017, nobody reported using a Smock brand device. But in 2018, 21% of youth did. So it went from 0 to 21%. I'm not sure what to make of that. It's a regular e-cigarette company. I'm not sure that all of that should be alarming. The effect of Juul, the manuscript focuses on two things. One, the advent of Juul, and two, the introduction of salt nicotine, e-liquids, both of which have much higher nicotine concentrations. And so it's legitimate to ask what effect would that have on smoking, vaping rates among teens, adults, or anybody else. But the time frame is a bit concerning because you're not going to see the full effect or any sort of real measurable effect of a product the same month that it comes on the market where you're doing the measurement of its impact. Okay? So were they to run this study again in 6 months or next year. Let's see what happens. But I mean, of course, Juul went from 0 to 10% because it wasn't on the market, then it was. Whatever percent it went to is a huge increase, right, by mathematical definition. Is it a worrisome increase? I don't know. You've got 10% of young people using Juul, which means 90% of them are using something else. What are we to make of that? The introduction of Saltnik happened, and what are we to make of that? Well, we don't know because we don't have any good measures of how many youth are using it, what strength are they using it at. The other thing that's true is that people who switch from cigarettes to vaping initially start with high levels of nicotine, usually the highest they can get, which used to be 24 milligrams, now it's 50, 59 milligrams. And then they reduce over time. They reduce their use of nicotine over time. So if you're looking at a new product entering the market at a high level of nicotine, you have to ask yourself, is it just as likely that these users are going to reduce their nicotine use over time as not? And there's been a study to help us answer that question.
Dr. Lalande, what's your message for Health Canada? Because they're deliberating right now on the next round of regulations. What would you have to say to them? Well,
I understand that they're in a tough position of trying to, as they keep saying, create a balance between stopping youth from initiating and getting adult smokers to switch. And so that's a real conundrum. But what I would say to them, if I could, is if you're aiming for regulatory balance, the absolute worst thing that you could do is try to eliminate or restrict flavors. As I have said before, if you restrict or remove flavors from the market, you are going to drive a significant percentage of those people who are trying to quit smoking back to cigarette smoking. And that would be a disaster. In terms of preventing youth use, it's already illegal to sell to youth. So making it more illegal is somehow going to help? I'm not at all sure. I really think that the public health message here is really simple and it's being ignored. And the message is, if you don't smoke, don't vape. If you're a teenager, an adult, anybody, if you don't smoke, don't vape. If you do smoke, whether you're a teenager or an adult, switch or quit, right? Simple message. You don't need posters of nicotine is brain poison and all of that sort of stuff. It's a much, much simpler message. If you don't smoke, don't vape. If you do smoke, quit or switch.
What advice do you have for Professor Hammond and his colleagues that for their next study? What could they do better?
Well, certainly if you're looking for the effect of a regulatory change, wait till you have like a year's worth of data after the regulatory change. You have to give time for behavior to be observable within the population. And so I think if I were to tell them anything, I would say do it again in a year and see what you find.
What about the Canadian Cancer Society? Could they be doing a better job here?
The Canadian Cancer Society has, for a very long time, opposed vaping in ways that I think are misleading. And I would hope that they would take a long, hard look at the science that's mounting out there about the fact that, look, this is a safer alternative to smoking. Not safe, but safer. This is something that works for a huge swath of adult smokers. This is something that works for teen smokers, because I think one of the things we ignore is that there are teens who've been smoking for 5 years and are still teens. Okay, so making vaping illegal or having more restrictive provincial regulations is just going to keep them smoking. And the longer people smoke, the more harm they're exposed to. So it's that risk exposure formula that I talked about earlier. You go after the people that have the highest exposure and see what can you do to lessen the harm. If you can't get them to stop doing the dangerous thing, whether it's drinking or smoking marijuana or smoking cigarettes or whatever, if you can't get them to stop it, can you get them to do it in ways that are less harmful? And the answer for all kinds of things is, of course, yes, you can. You can provide condoms. You can have needle exchange. You can do all kinds of things that reduce the harm of engaging in a particular behavior. And in the case of vaping, the harm reduction benefit is massive. And if you ignore that, if you remove it as a possibility from adult smokers or deny it to teen smokers, you're inviting in those unintended consequences.